Hello, welcome to the ALN Academy Talks. My name is Aisha Abdallah, and I'm very pleased today to welcome Dr. Girum Maheteme, who is the IGAD Health and Social Development Senior Advisor based in Addis Ababa. Welcome, Dr. Girum. Today we would like to talk to you, Dr. Girum, about your role at IGAD and in particular about what you have been doing over the last few years in terms of coordinating the COVID response. Welcome.
Thank you very much, Aisha. Thank you for having me, and nice to be in your institution, and glad to speak to you. My name is Girum Maheteme. I'm the IGAD Regional Coordinator for COVID-19 response, and also Senior Advisor for IGAD for working for the last 11 years. So, as you know, IGAD is one of the 8. IGAD is one of the 8 regional economic communities in Africa, working for 8 countries in the Community of Nations, and with a mandate of working to complement the health and social development agendas of the member states.
Okay.
So, IGAD is also working in a number of health and social development issues, including the COVID-19 response.
Oh.
So when the pandemic started, we have started our activity by heads of state and governments meeting, and then followed by the health ministers and the ministers of finance meeting. Then we launched a regional program and supported by the different partners, including the European Union, and many of the UN agencies and the German government, so GIZ. So the first focus was, as you know, the IGAD pandemic hit all the globe,
yes,
the continent, also our region, and we were not prepared in so many aspects to respond to this pandemic. So with the support given from our partners in the member states, we have decided to fill the gap of lack of supplies.
This is for vaccines.
Before vaccine, we were distributing materials to protect,
like masks,
yes,
and
what we call the personal protective equipment,
yes,
and also to strengthen the health system and referral system on supplying of ambulances, and also test kits and PCR machine for identifying cases, and also nitrile gloves, and so many supplies were distributed to all member states on the selected sites. So this is a huge undertaking, and it took us a lot of time, and also the procurement and distribution has been a very tough, challenging activity.
yes,
But we managed to at least distribute, and during the pandemic time, to reduce the impact of COVID on health and socio-economic aspect. The other issue is we have targeted populations who are living at the cross-border, and
right,
these are very far from the center, and very, in a very serious risk for COVID and other emerging health threats. So we want to make sure these refugees, migrants, and IDPs are also getting services from the health service facilities, and the health workers are going to reach them in the camps, and also in the cross-border sites on the migratory routes, and also we have included the trade zones, so that to make the trade zone safe, the traders, mothers, children are in a very high risk.
yes.
So the agreed programs were to expand health services, and also to expand the water and sanitation programs, and most importantly to have a risk communication strategy and community engagement through public education. So this is a broad agenda of the project, and
it's ongoing.
Ongoing, and I can say it has been successful, but it's not enough. So we have to expand and scale up.
Yes.
Yeah.
So I mean, I think the things you've mentioned were challenging across the world. No one seems to have been prepared for a pandemic like this, and it's exposed a lot of even developing countries in terms of adequacy of their healthcare systems. I imagine that IGAD, covering the 8 countries that you do, there were a number of challenges that you had to overcome, or perhaps you are still having to address now. Perhaps you could mention 2 or 3 of those challenges?
Yeah, as you rightly said, Aisha, the health system and the entire system were not prepared for responding to the pandemic, and in so many aspects, in human resource, in supplies, and also adequate finance has never been allocated to health and also social development issues. So we have to agree and also quickly act on a number of issues. So the partners were very, very responsive, and also the member states have also to agree on the same platform to work. The IGAD platform has been a very important platform to bring member states together. So in isolation, you cannot reach any results. So we need to collaborate, especially at the cross-border. So this was one of the main activity that we have to try from scratch. So this was a challenge, but we have tried to do a number of activities. One of the key activities is to establish a cross-border committees where border agencies, including not only health, but different sector, immigration, trade zones, and also law enforcement agencies and associations, NGOs, and even the private sector. So we have tried to make these committees at the cross-border and then within the country, and also collaborating with the next neighbor countries. Yes. So we have jointly organized a number of cross-border meetings, and then through these cross-border meetings, the border agencies have their role to play. Yes.
But some of the borders are very long and porous. For example, Kenya has a very long border with Somalia, much of which is probably not policed or has official agencies. I mean, how did you deal with challenges like that?
Yes, as you rightly said, the borders are very long, but the port of entries are many, but there are many, very few that are with high concentration of population, cross-border mobile populations, and also trade zones. These are selected, and we have managed to target those with high population and a lot of movement of influx of people. So we have identified from each country 3 big port of entries and the cross-border areas and trade zones. So the criteria and the selection was based on the number of population and also
crossing
the borders, and at the same time whether they have a trade zone movement or not. So we have identified and selected on the basis of the population size.
Okay. So another challenge I imagine would be that different countries responded differently to the pandemic.
Yes.
So we know that not all countries took it maybe as seriously initially. Some countries didn't have strict lockdowns, others did. How did you try and get consensus on the approach then?
Yeah, the IGAD platform is a regional platform bringing all the decision makers of IGAD member states together to agree on so many challenging issues like you mentioned. So we have agreed, in as much as the member states are in different stage of operation, but we tried to make a consensus on how to prioritize activities, and then also based on the priorities we act on the cross borders. So the main area that we have agreed is to strengthen the health system, that cross border area. For example, the health workforce working in the cross border area needs to have a training and also sensitization and also equipment. Yes, even sensitization. They need to be oriented on how to focus and prioritize without compromising the already existing health services in that area. So this is one, and the other one is agreeing to include in our activity other sectors to give it a multi-sectoral approach, so that it's not only a health intervention or health workforce activity only, but it will involve other sectors.
Because you mentioned the private sector.
Yes.
Give me an example of how the private sector was able to assist you in this project.
Yeah, in 2 areas, from the community and from the business perspective. At the cross-border, as you know, there are trade movements.
Yes, there's
so traders and also private sector and investors who have invested their resources on clinics and also pharmacies are, expected to play to cooperate with the health offices and also the hospitals and health centers that are existing at the cross-border. In a very larger area also, the Trademark East Africa is one of the private sector that was engaged in financing and at the same time availing vaccines and also training people. So that, there are many players in this project, so starting from European Union, UN agencies, Trademark East Africa, and even the banks. African Development Bank is assisting IGAD and the member states to fight this COVID. So they avail finance and they are also technically assisting. So the private sector has a key role, and it has never been before, participating in a number of activities. But now, thanks to COVID, in as much as it is a challenge, it is also an opportunity to bring in one
people
platform
together.
Yes.
Okay. So that brings us nicely to my next question, which is that as we know, the COVID pandemic is continuing. We don't know how the rest of this year will shape up. We've relaxed in a number of areas, and we are yet to see whether that will be effective or not. There must be some key lessons that we should be learning how to do things better the next time we face a pandemic. What might some of those lessons be?
Yeah, this is a very good question, and as you know, we're not prepared, and it was a very devastating effect of the pandemic. But it was anticipated at the earlier time that we need to have an early warning system and also preparedness for any emerging threats and pandemics, epidemics, and also outbreaks. But we were not prepared. We need to have adequate finance. We were not also getting adequate finance from governments on health sector and also preparedness at the cross-border or at the vulnerable groups. So the biggest lesson that we took from this crisis, one is to have an early warning and preparedness mechanism, and the second one is a continuous surveillance system and monitoring, and then based on that, if we have any evidence of a health threat or outbreak coming, then an effective response mechanism should be designed. For this, we need to have a health workforce ready, we need to have a training of health workforce, and also we need to have adequate finance. So learning from the past, we need to agree with governments, and the best platform is the IGAD platform to make a ministerial meeting for health ministers, and then this usually is preceded by experts discussing on a number of issues. So we need to do more of that, and then if we agree on that, then adequate finance resources and technical assistance will be mobilized from the partners. And as I said earlier, in as much as it is a challenge, it was also an opportunity to bring all stakeholders relevant for this response to come together and work together than ever before. Yes. And member states also need to cooperate because disease has no borders, and we need to focus, serving the community, and special needs of vulnerable groups should be addressed. And one of the area is health intervention. So member states between 2 countries or 3 countries need to cooperate, and also under the regional platform, the member states need to cooperate and work together. This is the biggest lesson that we learned, and most importantly, adequate preparedness is the key.
Yes. So I think the thing that you said that I will take away is disease has no borders. So I think initially this disease was seen to be primarily affecting China, and we quickly realized that it affects all of us. Do you have any comment to make on the availability of vaccines, particularly the disparity of availability in the Western world as compared to Africa?
Yeah, this is again another very important point to discuss. In the past, we were given for IGAD, Health and Social Development, as one of the mandate to complement the health agendas of member states and address one key area is, to cooperate and design programs for any vaccine preventable diseases, including the 6 major child killer diseases that exist in the world. So particularly, affecting African countries and the region. So in this area, we haven't worked very well. So there is a reluctancy, and as I've said, no finance, and also no attention and focus of discussion has not been designed on this area. So we need to agree on how to make this program stronger, like availing vaccines and also educating the public and so on. So whenever such kind of pandemic comes, and we may have to look for other resources and other source of funding. So for now, as an emergency, we have done our best to use what we call the COVAX facility to bring all vaccines to member states. And the next step is to have donation from Western countries and also from China, and other countries also are willing to give vaccines. But the access to vaccines is highly dependent on the amount of vaccines that is available. So as you can imagine, and as you have heard, that the vaccine deployed and distributed to African countries is very insignificant. It's very insignificant. It's below 10% of what we should expect from for our population. So the coverage is very weak now. So in order to increase, we need to have two things. One is to have a local manufacturing of vaccines in the future. All member states should have to think about it.
Yes.
And IGAD is working on that, and we are part of the African Union policy and strategy on African Medicine Agency to produce locally manufactured vaccines. And we want to use the pharmaceutical plan for Africa as one of the sources of vaccine, and not only vaccine, but medical supplies, medical products. So this is the long-term vision. For immediate vision, we want to make vaccine accessible to our population through donation, and we are trying our best to have a share globally purchased through competitive bidding, globally purchased vaccine to be distributed. But one key area also is mitigating the problem of vaccine is to have public education to improve the vaccine hesitancy. Even though the vaccine is available, people are reluctant to go to the vaccination center and have these vaccines. This requires a lot of work on public education aspect. So we need to educate our people how vaccines are very important, how prevention is better than cure, and then before something happens, we need to boost our immunity through vaccine. All these things needs to be communicated to the public, and the health workforce are ready, but we need to aggressively give the community engagement and then propagate the message. So these are the areas where the vaccination. And another point, finally, I would like to say, when you have a vaccine, you need to have a facility to distribute to the needy at the grassroots level. To do that, you need to have a cold chain system. But the health system has not have a very good cold chain system in the past. So we need to have adequate preparedness.
Cold chain as in storage or?
Yes, storage and distribution. You need to
which requires some money.
Some of the vaccine need below 8 degrees centigrade. Some of require below 2 degrees centigrade. So that requires a huge purchase and distribution of refrigerators and cold chain systems until
it reaches the grassroots. So, and I think that was some of the challenges of accessing some of these vaccines was how do you keep them stored appropriately?
Stored and distributed. Another mechanism is to use a mobile clinic so that people will access to that mobile facility and then get tested, get vaccinated, and even public education campaigns can be done through mobile vans so that people who are very far from the center and at the periphery and at the cross-border area will get messages through these mobile activities, outreach activities we call it. So this needs a robust plan and adequate finance, and then in the future, even beyond the pandemic, we want to make the health system ready, robust, and also resilient to any emerging threats.
So I think it's been wonderful to hear from you, Dr. Girum, and to hear your insights. I think you have a lot more to say, and we'll look for other opportunities to maybe come back to you on some of these issues. Maybe I can just summarize some of the key points you made. An effective pandemic response requires cooperation across borders because disease has no borders. You mentioned financing a number of times, that a lot of this goes back to inadequate health budgets to begin with. So I feel that the pandemic has assisted your arguments because there's a clear link between the pandemic and its effect on trade and the economy. So I feel like your finance ministers are hopefully going to be more supportive of your agenda. But I think finally, we do need the support of the rest of the world. And hopefully you will agree with me that there should be equality of access to basic medicines and basic preventative care. And that it's not possible to segregate one part of the world from the rest. If we are not all protected, we are all at risk. So I think on that note, thank you very much. We look forward to seeing you again on ALN Academy Talks. Thank you.
Thank you, Aisha. Thank you for having me. Great pleasure.